Welcome back, everyone, to TV5 News at 9. We're continuing discussions on proton therapy. And joining us this morning, we have Dr. Christian Hyde. Dr. Hyde, thanks for joining us this morning. How are you?
I'm doing well, Blake. Thank you.
Yes, of course. Thanks for calling in. We're talking about proton therapy and lymphatic cancer. So, Dr. Hyde, when people get a cancer diagnosis, they often learn that the cancer has spread, especially to lymph nodes. So how common is it for cancers to spread to lymph nodes?
Yeah, so it's actually quite common, and sometimes that's the first sign of a cancer will be an enlarged lymph node. So, for example, when people get throat cancer, like in the tonsil or in the tongue, one of the first signs is an enlarging lymph node. Men will often discover it shaving. Women might notice it, putting makeup or lotion on. And that lymph node in the neck is kind of cancer until proven otherwise. So if you get an enlarged lump in your neck, bring it to your doctor's attention.
Yeah, it's certainly scary. What kind of dangers does that pose to somebody?
Right. So we talk about cancers by stage. Stage 1 means it's kind of localized. It hasn't gone anywhere. Stage 2 means a bigger tumor that generally hasn't spread. Once it gets into the lymph nodes, that's almost always a stage 3. And those are life-threatening because they're more likely to come back and they're more likely to show up in other organs like the lungs, the liver, the bones, what we call stage 4 cancer. So it's kind of the next step often before we see it show up elsewhere. So it's really important to get in quickly and to get that treated as soon as possible.
Yeah, absolutely. Dr. Hyde, you are able to treat many types of cancers at the McLaren Proton Therapy Center. Can you treat it, though, when it spreads to the lymph nodes, and when would that be a good choice for patients?
Yeah, sure. So cancer that has spread to the lymph nodes, in my opinion, is one of the best reasons to use proton therapy because we're treating a big area of the body and it's often close to vital structures.
Yeah.
The lymph nodes run along the arteries and the veins, and those are vital structures. And they supply other important organs of the body, like the lungs and the heart and the throat, for example. So it's really important to stay off of those normal parts of the body. And we can do that using proton therapy. For example, if I can share, so I use protons. One of the advantages is that we can stay off the other side of the body. The great thing about protons is they go in one side, but they don't go out the other. Traditional radiation or X-rays has an entrance beam, but it also has an exit beam. It goes in and it goes out the opposite side. When we use protons, we can, as shown in this X-ray picture, this CAT scan on the left side of your screen, you can see how the radiation in this red area is being given next to the patient's jaw, but we're staying off the jaw. We're also staying out of the vocal cords here in the middle. We're staying out of the throat, which is really important because when we treat the head and neck, one of the #1 complaints is people say, I can't eat my favorite foods, I can't swallow right, or they're hoarse, their voice quality isn't as good. And so being able to radiate the lymph nodes is important for cure, but we don't want to radiate more than we have to. And sometimes we have to treat lymph nodes on both sides of the neck. And then it's even more challenging to stay out of the vocal cords and the areas to swallow. So this patient, in the X-ray, we're treating the left side, we're treating the right side, and that can make it very difficult for patients to swallow. But it's been shown through research at major cancer centers that when we can do this, when we use protons, patients are more likely to keep eating, they're more likely to keep working, their quality of life is better, and they're less likely to need a feeding tube. So it's really, really important when we're using radiation therapy to spare these critical organs. And protons help us do that.
Yeah, and it sounds like it's less disruptive to the client's and patient's life, so that's always a plus. So Dr. Hyde, McLaren has the only proton therapy center in mid-Michigan. It's one of 2 in the state, so we're pretty lucky to have this. How does a person find out whether proton therapy is right for them?
Sure. So patients can learn more by calling us at 855-MY-PROTON. That's 855-MY Proton, Proton, or by going to our website, mclaren.org/proton therapy.
Very good, Dr. Hyde. Thank you for calling in with this great information about lymphatic cancer.
Thank you.
You're very welcome. You can find more information by going to the Hot Links section of our website at WNEM.com.